Welcome back to our integumentary lesson. We're going to pick up with skin color. So melanocytes are going to be the cells that produce melanin in structures called melanosomes. This melanin is going to give our skin its pigment, its coloring. It's responsible for skin color from a pale yellow all the way to a black color. You have what's referred to as pheomelanin. That's going to give skin a red to yellowish form of melanin. You can have what's called eumelanin, and that's going to go from a brown to a black form of melanin. So depending on your genetic makeup, depends on which type of melanin that you inherited and what shows in your skin. So melanin production is going to increase with an increase of UV light. So the more that you're out in the sun, the more melanin that your body's going to produce, whether it is the pheomelanin or the eumelanin, and that's going to cause your skin to tan or to darken. So in the wintertime, when you're not outside as much, your skin might lighten up some, versus when you're outside more, when it's warm outside, it might tend to be a darker color because you're being exposed to more UV light, and depending upon whether you have the pheomelanin or the eumelanin as to what form your suntan comes in. So some people produce more melanin than others, thus they're going to have darker skin, and the more you're exposed to UV light, the darker that skin can become. So looking here at this diagram, you're going to see that you have that melanocyte sitting on that basement membrane. And so it goes along with the basement membrane, and it is embedded within that stratum basale there. And you see it kind of looks like a octopus sticking out. So it has those little tentacles. Those dark circles that you're going to see there are going to be the melanocytes that are going to be produced or producing melanosomes. Those melanosomes contain the melanin. So as it produces them, they are then going to go off into the tissues that are surrounding that melanocyte, and they're going to help absorb UV radiation and UV light that's coming into the body, and that's what's going to give you a tan. So as those cells start from the bottom layer at that stratum basale, they're going to move up, and as they move up, remember they start to die out, and depending on how much sunlight or UV light you're exposed to depends on how that skin tans because of those melanosomes there with the melanin inside. And so if your skin is continuously moving up and shedding, remember you lose many cells throughout the day. So as it's shedding, you usually get a completely new layer of skin within 4 to 6 weeks. You have to keep tanning and exposing yourself to UV light if you want to keep that suntan, because these cells, as they move up towards the top layer, that stratum corneum, they will shed, and then your tan will start to fade out and you'll start to lose that tan. So freckles are going to be places where melanin concentrates in large amounts. So if you go out in the sun, you might see that they're absorbing a lot more UV radiation, and you will develop these freckles. Moles are going to be local skin areas with an overgrowth of melanocytes. Vitiligo is going to be white patches where you find no melanocytes. Now here, the melanocytes could have died out and they didn't replace themselves, and so therefore your skin no longer tans there and no longer keeps its color, so you'll end up with white patches. Albinism is when the melanocytes are not producing melanin, and so this is going to be a genetic disorder that you will see in people, and with them they usually will have other characteristics that go along with that. Other skin colorations, you can have keratin in your skin. That's going to be a yellowish or orange pigment in your skin. You can take these in through different foods. So if you eat a lot of foods such as carrots or sweet potatoes that have a lot of orange pigment or keratin to them, it can actually start to turn your skin a yellowish color or even an orangish color. Hemoglobin is going to give skin its pinkish tones. So this is going to be the pigment in excess can lead to things like blushing. So your blood vessels will dilate and that color rushes to your skin. And when it's deficient and those blood vessels constrict, it can actually cause you to turn blue. For example, when you're really cold, and that leads to a condition called cyanosis. Cyanosis, you need to know, that is when you appear to be blue. That's due to lack of blood. Erythema or redness of the skin can be because of fever, hypertension, inflammation, or even allergies. So if you're going into the medical field, it's going to be important that you're able to pick up on erythema and things. You might be able to pick up and see that somebody has a fever or hypertension or some type of inflammation in an area by looking at this. Bilirubin is going to be the release from breakdown of red blood cells. This is going to cause jaundice if it's not cleared out of the body. And with that jaundice, it causes yellowing of the skin, or you could look at the whites of people's eyes and they would actually start to yellow. So the buildup of this bilirubin is toxic. Usually happens when the liver is not doing its job properly and getting rid of the bilirubin. Pallor is going to be the paleness of skin, and that's going to be due usually to shock. And what happens here, you're going to have a loss of blood, and it causes, or the blood drains from the body. So you might look, people would say, white as a ghost if you're really shocked or if you're scared. Or it could also occur because of anemia, because you don't have enough iron in your blood to get enough oxygenated blood to different areas of the body, and it could cause you to have pallor. So some accessory structures of the skin or derivatives are going to be of the epidermis, even though when you look at a hair or you look at some of these structures, they look like they're actually deep down in the dermis. They're derivatives actually of the epidermis, so they belong to the epidermis. So we're going to talk about hair and hair follicles. We're going to talk about nails and sweat glands, and of course sebaceous or oil glands. Starting off with hair. Hair is going to be made up of dead keratinized cells of hard keratin. And so these are going to come from those dead cells of the epidermis. They're going to be more durable than soft keratin that's going to be found in the skin. We are not going to find hair in certain places of our body, places that might keep the body from doing whatever its function is. So you're not going to find it on places like the palms, the soles of your feet. You won't find hair on your lip, on your nipples, or on portions of external genitalia. Functions of hair is going to include a warning, so it warns of insects on the skin or of something being very close to you because you might feel the hair move. Protection from physical trauma. It would cause things to kind of like slide off. Reduces heat loss, so helps trap heat in and keep you warm. Protection from sunlight, so it does help to cover certain body portions and absorb some of that UV radiation to protect you. And your eyelashes and eyebrows are going to be there to help protect your eyes, to help keep things from running into your eyes. Think of how sweat on a hot day can run into your eyes. So your eyelashes and your eyebrows are going to help protect from that. And then your nose hairs are going to be embedded within the nostrils, and those are going to help to pick up on anything that's coming into the nose as you're breathing. So it's going to work with mucus in order to help trap any impurities that you're breathing in. Okay, so looking here at this picture of the hair, you see how it's embedded within the actual dermis, but if you notice, it's going to be part of that epidermis that's coming around. And so look at the pink, notice how that pink goes around, so it's actually simply part of the epidermis. You see those ridges there. The ridges, remember, are going to be your papillae that are going to be found on the skin, the dermal papilla. Those are going to make up things like your skin prints and your fingerprints. Within that hair, you see that root plexus. The root plexus is going to be made up of the nerves that are going to be attached to the hair. If you've ever pulled a hair out, you definitely know that you can feel it, and that's because you are pulling at these nerves here. You're going to have connective tissues that go around the hair that help to protect it and help to anchor it in. You have the hair root that's going to be found within that hair. You also have a muscle that's attached to that hair sheath, which is going to be called the erector pili muscle. Now with that muscle, it's going to be what pulls that hair up when you get cold or chill bumps. So this is what makes that hair stand on end. It also helps puff up on different animals when they become frightened or mad, and it makes their hair stand on end. Also, looking up above that, you have the sebaceous gland. This is going to be the oil gland. Notice how it's attached right there at that hair. So it's going to help lubricate the hair as well as come out where the hair is and lubricate that skin around the hair. So looking here, you're going to see that you have the connective tissue sheet that goes around the outer layer of that hair that's embedded within the dermis. that section that dives deep. You're going to have what's referred to as a glassy membrane. That's going to be that purple part. You have the external root sheath that you're going to see around that hair. You have what's referred to as the internal root sheath. Then when you actually go into the hair, you're going to have the cuticle of the hair. You have what's referred to as the hair cortex. Then in the center, you're going to find that medulla that's going around there. You also have what's referred to as the hair matrix. Now this section of cells here is where the hair is actually being made, and as it's being made, it gets pushed up and then out towards the outer portion of the hair shaft, which is the part that you brush or cut, the part that you actually see. And so as it goes up and gets pushed up as it's growing, it will start to die out because it's getting further and further away from its nutrients. Now that nutrients you're going to find in that hair papilla. So here in that hair papilla, you see that you have blood vessels. So you're going to have arteries bringing nutrients and oxygen to those cells to feed the hair cells, which are creating the hair. And they're going to carry away carbon dioxide and waste products in the veins. And so towards the bottom of this little section here, just simply here and here, that's going to be referred to as the root bulb or the hair bulb at the end. And then underneath, you see some subcutaneous or adipose tissue there at the bottom. So chief regions of the hair, like we talked about, the shaft, that's going to be the part that comes out of the hair. That's the keratinization is complete, the hair is dead, and that's the part that you brush, you cut, you fix. It's going to project from the skin and extend halfway down portion of the hair embedded into the skin. So we just saw that from the picture where it goes into the actual dermal part where it's embedded, but it's still part of the epidermis. So to determine what types of hair you're going to have is going to be dependent upon what the actual opening as it comes out looks like. So if you have a flat opening, it could end up as being kinky or curly hair. If you have more of an oval opening, it's going to be silky and wavy. And if it's a perfectly round opening, it's going to be straight or coarse hair coming out of that opening. And so the root of the hair is where keratinization is still going on. The remainder of the hair, or deep within the follicle. And so with that, remember that keratinization is occurring, it's going through mitosis, it's creating more, and they're getting pushed further and further up, and that's actual growth of the hair that's coming out of the hair shaft. And so the root and the shaft are going to have 3-layer construction. We talked about the medulla. That's going to be the central core of that hair. It consists of large cells and can even have air spaces in it. It's going to be absent in fine hair, so you will not find a medulla in a fine hair. Cortex is going to be the bulky layer. That's what surrounds the medulla, and it's going to have several layers of flattened cells there. And then you have your cuticle. That's going to be a single layer of cells overlapping one another. It provides strength and keeps the inner layers tightly compacted. So once the hair comes out of the head, these are going to be the 3 parts that it contains. So underneath where you see all the other, for example, within that hair follicle is going to consist of that internal root sheath, the external root sheath, and so they are put together to make the epithelial root sheath. Then you have that dermal root sheath that goes around it, and then you end up with that bulb. So the actual part that comes out of the hair or out of the opening that you actually fix is only going to consist of the cuticle, the cortex, and the medulla. And so this is just a view looking down from above. You're going to have different types of hair growth. So different types of hair growth. You have lanugo, that's going to be fetal hair. So this hair falls off shortly before the baby's born, or even it could be born with this fetal hair on it, and it will start to shed this hair shortly after it's born. So it could be on there when it's born, or it could fall off right before birth. Vellus hair is going to be short, pale, fine body hair. You find this all over everybody, girls and boys. Lots of times it's referred to as peach fuzz. So if you look at your arms, you might see the vellus hair in your arms. You might have it on your face. Sorry, going backwards. Termina hairs are going to be hairs that are coarse, long hair of eyebrows, hair that's found on the scalp, things like that. and eyelashes. These terminal hairs tend to start growing more places throughout the body, like underneath the underarms and in the pubic regions at puberty. They appear, like we said, in the axillary areas under the arms. They also start to appear on the face and neck of males at puberty, so that's when they need to start shaving. And hair growth can be determined upon many different things. It can be determined upon nutrition, so if you're not receiving the proper nutrients in your food, your hair might stop growing or you might lose your hair. It can also be determined upon different things like hormones or chemotherapy, radiation therapy, age. As you get older, both males and females start to lose hair and it does not grow as fast. Genetics, gender, and stress affects hair growth and could actually cause hair to fall out. The follicles are going to have certain cycles that they go through. So you'll have follicle cycles between active and regressive phases. The average hair growth per week is going to be about 2.25 millimeters of growth. You're going to lose anywhere from about 100 or 70 to 100 scalp hairs a day. So if you have really short hair, you might not notice as much hair falling out. But if your hair is really long, it's going to be more noticeable because you see that long hair sticking to things. So if you were to have a handful of short hairs and a handful of long hair, both of them containing 100 hairs, the handful of long hair is going to look like you've lost a lot more hair than the short hair, but it's going to be the same amount. Hair color could be due to the amount and type of melanin present in the follicle. So remember, you have the eumelanin, it's going to create the dark hair, and you can have the pheomelanin, which can create the lighter color hairs. So dark color, like we said, brown to black, eumelanin. Blonde or red color is going to be the pheomelanin. Gray hair is going to have low amounts of melanin, so those melanocytes are going to start to produce less and less melanin as you get older, until eventually they don't produce melanin anymore, and that's when the hair turns white. So that's the lack of melanin, and lots of times when you look at it, it is going to actually have hair bubbles in that hair shaft. So looking here, you can see that epidermis and dermis. Notice how that hair follicle goes all the way down into the dermal part, but it's still surrounded by the epidermis. It is part of the epidermis. You see the structures that are attached to it, like the erector pili muscle, which are going to actually pull it up taut and make that hair stand on end. You see those sebaceous glands that are going to be connected to it, and so remember, those are going to be there to help lubricate that hair as well as lubricate the skin. So going into the sebaceous or oil glands, they're going to be widely distributed, usually attached to a hair. You will not find these in thick skin of the palms or on the soles of the feet. Most of these will develop from hair follicles and secrete onto the hair follicles. They're relatively inactive until puberty. You will have some oils on the skin, but they really become active at puberty and as you get older. Once you get to a certain age, though, they do start to deactivate again, and you start to have less and less of this oil on the skin, and so then your skin does start to dry out. So relatively inactive, like we said, till puberty, become really active, and then go inactive again. This is simply going to be stimulated by hormones, especially androgens. Androgens are going to be male-type hormones that will actually kickstart puberty. The oil that they secrete is going to be referred to as sebum. This is going to be a oily holocrine secretion, and if you remember when we talked about different types of glands, this is going to be the type of gland that secreted the whole cell. It is going to be a bacterial side, so this means it's going to kill different types of bacteria that can be found on the skin and in the hair, but it's not going to kill all of the bacterial types. It's also going to be there to help soften hair and skin, so it helps to moisturize, and it actually even helps reduce water loss from the skin. If these sebaceous glands can become clogged or bacteria gets in, it will cause an inflammation, and that is what you see with acne. Now with your sweat glands, these are also going to be referred to as sudoriferous glands. All skin surfaces except for the nipples and parts of the external genitalia do contain sweat glands. We have about roughly 3 million sweat glands per person. We're going to have two main types. First is the eccrine sweat glands, which are a merocrine type of sweat gland, and then you have your apocrine sweat glands. These are going to contain myoepithelial cells, which contract upon nervous system stimulation to force that sweat out and into the ducts. And from there, it's hopefully going to help cool you off if it's a eccrine type of sweat. If it's the apocrine type of sweat, it has kind of a musty smell to it. That one starts at puberty, and that gives off different types of pheromones in with it. Okay, with the eccrine sweat glands, these are going to be the most numerous sweat glands that you're going to have. These are found around the body. They're especially going to be abundant on the palms, soles, and on the forehead. Now with the palms and the soles, they're actually going to be activated, let's say, when you get excited or nervous. On the forehead, lots of times it's activated. They're there for like thermoregulation. And so that's when the blood vessels will dilate, causing those that blood to come closer to the surface of the skin. That way you can release it and cool down. Ducts, of course, connect to the pores of the skin. And so you'll see how they empty out onto the skin to help cool the skin. And like we said, it's there for thermoregulation. And it's going to be regulated by the sympathetic nervous system. This is going to be like your system that regulates if you are nervous, if you're anxious, and it also takes care of when you're hot. So the secretion, like we said, is going to be sweat. It's 99% water. It will also contain things such as salts, urea, ammonia, which is going to be basically the breakdown of things like amino acids and proteins within the body and some DNA. It also consists of ions, lactic acid, and other components. With the ions, it's going to be important that if you're replacing water in your body that you have lost through sweat, you also have to replace those ions as well, because that's going to help with your nervous system and the electrical system running through the body. And so looking here, you see that sebaceous gland, which is going to be the oil gland. Notice how it's attached to the hair follicle. And then looking at the eccrine sweat gland, it kind of looks like a ball of a tubule ball, basically. And notice how it goes up through the dermis, through the epidermis, and exits out through a sweat pore on the top of the dermis or top of the skin. If you look over to the right, that's simply what that eccrine sweat gland looks like under a microscope if you had a slide of it. Also notice with the eccrine sweat glands, it's going to be midway kind of up through the dermis portion. When we talk about the apocrine sweat glands, these are going to be found deeper within that dermis layer and even into the hypodermis layer. So these are going to be confined to the axillary or anogenital areas, also pigmented areas of the breast. They're going to consist of a substance that they release. It's going to be sweat, a fatty substance, and proteins. So it's going to be very viscous, almost a milky-ish type substance that comes out, or a yellowish type substance. Now when it comes out, it's going to be in very small amounts, so you don't actually see that. It's odorless until bacterial interaction with it on the skin. And so that's what's going to give you body odor. Now, if you were to use a antiperspirant, that's going to kind of block some of these sweat glands, and it keeps them from releasing their substance. But if you take a deodorant, that's actually going to be kind of a antimicrobial, so it's going to actually affect that bacteria, so the bacteria can't produce their waste products that cause you to have that body odor. Like I said, these are going to lie deeper within the dermis and even sometimes within the hypodermis. Those ducts usually going to empty onto hair follicles, so it could be hair follicles in the armpits, on the head, or even in the genital region. These begin to function at puberty. Function is unknown, but like we said, when we see it in other animals, it tends to help with sexual scent glands, pheromones, things like that. Modified apocrine sweat glands are going to be your ceremonious glands. These are going to be the ones that line the external ear canal, and they're going to secrete cerumen and that is actually just earwax. Another type you're going to have is going to be the mammary glands, and these glands are going to secrete milk. So here we are just looking at the different types of sebaceous glands. This one's attached to that hair, so you see it touch the hair. Let's move on into nails. Your nails are going to grow about 1 millimeter per week. They're going to simply be scale-like modifications of the epidermis. They help to protect and cover the distal ends of the fingertips, and they're going to be found on the dorsal surface of those fingers and toes. They're going to contain a hard substance, which we've already talked about, which is keratin. They're going to have several different parts that we'll look at. They'll have the free edge, the nail plate or body, and the proximal root. They'll have a nail matrix, and that's going to be responsible for where the nail grows. So those are the cells that make up the cells going through mitosis that are pushing that nail up during growth. So looking at that a little bit closer, first you have your nail root. That's going to be the portion that is not going to be visible, so it's going to be underneath the skin, even below that cuticle. You have that epigeneum, which is going to be the actual cuticle, and that's going to be part of the stratum corneum of the epidermis there. Not everybody has these, but some people do, and it is genetics. Sometimes I only have these on my thumb, for example, and that's called the lunula. That gets its name because it looks like a crescent moon, and so luna is a name for moon. That's simply going to be a thick white part of the nail. Then you have your nail bed. Notice how it's underneath that fingernail. So it's going to be the skin that's below the nail plate. The main body of the fingernail is going to be referred to as the nail plate. And then the free edge is going to be the portion of the nail that's coming past the skin. That's the portion that you can bite on or that you clip off or even file. Then you have your hypogeneum. That's going to secure the nail to the fingertip. And then underneath that, you see that you have the epidermis, then the dermis, and then the phalanx. That's going to be the actual bone there in the nail tip. Now looking at that nail matrix, those are going to be the cells that are actively going through mitosis. And as they go through mitosis, they're going to push up just like with the hair and just like with the layers of the skin. And so that's what's actually helping to create that fingernail. So different things that you might see with the nails. Looking at the nails where they are blue up top, that could be a form of cyanosis. That could be due to needing more oxygenated blood into the bloodstream. It could be because you're very cold. It could be due to different types of anemia. Over where they are yellow, sometimes it's due to lack of oxygen on the nails. So if you were to paint your fingernails and keep them painted for a long time and then take that fingernail polish off, you might see some yellowing of the nails. That would be due to lack of oxygen getting to the nails. Or it could be due to a fungus in the nails that you see there. So if you don't paint your nails and they're starting to yellow, that could be due to a fungus. And then you see different colors or lines in the nails. Those could actually be due to different types of cancer. So looking at the brain, you see some somatosensory, you see visual, auditory, gustatory, olfactory, and motor. And so this is going to be determinant upon what portions of the brain actually pick up on feeling. And so all of your different nerves through your integumentary system. And so if you were to look at the amount of nerves that you find in different portions of the skin, this is how your body would look. So if you had larger portions according to the more nerve endings that you had, look how big your hands would be. You have an extreme amount of nerve endings that you pick up through the integumentary system of the hands, followed by your lips and your tongue. You also have a lot in your ears. And so this is just a general characterization of if you were to make a body according to how many nerves that you have and how it picks up using the integumentary system. Okay, so different skin problems or skin conditions. Okay, with these skin conditions or skin problems, we have dermatitis. Itis is going to be the inflammation. Derma, of course, is skin, so this is going to be inflammation of skin. And so there's many different types. You could have hay fever from allergies, hives from allergies. You can have food and drug allergies, eczema, measles or chickenpox, which are going to be viral diseases. You can have different types of bacterial infections like staphylococcus infections, leprosy, venereal diseases, which are going to be sexually transmitted diseases. You could have fungal infections such as ringworm and athlete's foot, and mites like scabies. Here's an example. We have a mite here. And so when a mite bites you, such as a chigger, for example, if it bites you, it's going to have a little extension of its mouth called a stylostome. It's going to stick that into the skin. When it does that, it ejects some of its spit. Its spit will actually start to turn your skin into a liquidy substance that it can eat. And so your body doesn't like that. So it's going to send out a histamine reaction. And with that histamine reaction, it's going to cause swelling and itching there. And so the mites or chiggers and scabies, they could be gone. These mites here, which are chiggers, are not going to be actually on the skin. I know you hear lots of wives' tales. Cover it with clear fingernail polish or do things like that to get rid of them. They are not on your skin. This is simply where they bit your skin. And so they'll bite the skin. It causes an allergic reaction or a dermatitis reaction. And that's when you end up with these really itchy spots on your skin, these whelps. And so you can take things such as cortisols, steroids, or maybe even Benadryls or a Benadryl cream and rub on there. And this will help diminish that allergic reaction and help with that itching. Now, mosquitoes are going to be another type of insect that is going to be vector for different types of diseases. They're going to have a very thin, pointy stylum that they're going to put into the bodies. So with that, they have a type of spit that's going to be around it that is going to make it so you don't really feel it going into the skin. But along with that spit, it's going to also be an anticoagulant. So it's going to keep your blood from clotting. So scabs won't form and it won't clot. So it's going to make you a free bleeder for them. That way they can suck the blood right out. So if you look at this picture, notice how it is sticking its stylostome in. It's going directly to that little artery there, and it's going to be able to suck that blood out because of the anticoagulant that it has on there. Now, once it's done, it will fly off, and then your body's going to create a wheal that is going to be a itchy allergic reaction to its saliva that it just spit into you. Also, there could be problems if it had any type of bacteria in its saliva or spit, or if it had a virus in it. And so that's how they're going to be able to be vectors for different types of viral and bacterial diseases that they can spread. Skin cancer is a cancer that a lot of people will end up having in their lifetime. It's going to be actually very common. You can have different types of skin cancer. You can have what's referred to as squamous cell carcinoma. Then you have basal cell carcinoma. Now, out of the three that we're going to talk about, squamous cell carcinoma and basal cell carcinoma, those are going to be very common, but they're kind of the better ones to have because they are not going to be as dangerous as the third type. That's going to be your malignant melanoma. The melanomas are going to be very dangerous. They do metastasize and move through the body very quickly, and so these can actually be fatal. So looking here, we see the basal cell carcinoma in picture A. You see squamous cell carcinoma in picture B, and then a melanoma there in picture C. Now, in order to identify melanoma, you have what you refer to as your A, B, C, D, E's of melanoma, and you do have to know these. You're going to have to be able to give me these on a test. A is going to stand for asymmetry, so if it's asymmetrical, looking over at the left-hand side, notice how it's nice and it matches on each side. If you look at the right-hand side, that is your asymmetrical. That one does not match up. B is going to be border. If the border is nice and round and smooth, then that one is going to be okay. If it is uneven and scalloped and notched, that one's going to be one that you want to get to the doctor and have it looked at right away. The next one is going to be color. So shades of brown, tan, or black. red, blue with white later, those are going to be ones that you want to go get looked at also. Notice how with that color on the right-hand side, how it's really dark on one side and it kind of fades into another color towards the right-hand side. That is one that you need to look at, whereas the one on the left-hand side is the same color across the entire mold. Diameter is another one. So if it's the size of a pencil eraser or larger, definitely go get it checked out. If it's smaller, keep an eye on it. And evolving. So any change in size, shape, or color could indicate that it may be changing over into a malignant form. So also go get that taken care of and checked out. So a normal mole you see on the left-hand side. Malignant melanoma you see on the right-hand side. Frostbite. Frostbite is going to be when you damage tissue on the hands or the feet or anywhere on the body when it becomes too cold. That damaged tissue starts to die, and it's a form of necrosis. And so as it's dying out, it can spread infection. So when it's dying out, you actually have to go in and you have to amputate or take it off above where you see it starting to change. Because if you start to take it off where it's changing, then it's going to continue to spread. And you will end up losing more of that limb or that finger or toe, or you could even lose your life. Another important thing that you need to know about skin is going to be how to establish how much of the body is burned. So looking at the head is going to be 9%. And so when you're doing a quick, rough estimate of burns around the body, let's say that you're working for an emergency room, or let's say that you're on the rescue squad and you're going to pick up a burn victim, you're going to be asked to quickly give a percentage or a estimate of how much of that person's body has been burned. And so we're going to use what's referred to as the rule of nines. You need to know that this is called the rule of nines. And so looking at the head is going to be 9% total. The anterior head and neck, which is going to be the front part, is going to be 4.5%. And then the back of the head is going to be the other 4.5%, coming up with your total of 9%. Coming down to the trunk of the body. The trunk of the body is going to be 36% total. Out of that 36%, the front trunk of the body is going to be 18, and then the back trunk of the body is 18. Each arm is going to be a total of 9%. The front of the arm or anterior is 4.5%, and the back of the arm or dorsal or posterior is going to be 4.5%. The perineum is going to be the genital area that accounts for 1% of the body. Each leg is going to be 18%, with 9% in the front of each leg and 9% in the back of each leg. So if you put both your legs and thighs together, you end up with 36% total. Adding all of those up together, you should come up with 100%. So going into decubitus ulcers or bed sores, this is going to be when you put pressure on an area for too long. We find this in a lot of patients that are in the hospital or in nursing homes that are in bed or bedridden for a long period of time. You need to go in and make sure that you move those patients. If you do not move those patients, then that pressure on the skin starts to actually cause sores or ulcerations in the skin, and it destroys the tissue. Here's a pressure ulcer on the heel of somebody who possibly laid in the bed for way too long and nobody came in and moved it and checked it to make sure that that area was relieved of pressure. With the top picture that we're seeing here, that's actually going to be a needle inserted into the skin. This is going to be an example of getting a tattoo. So if you get a tattoo, that needle actually is inserted into the dermis part of the skin, and that's where the ink's going to be deposited. If you were to put it into the epidermis of the skin, you would slough it off and you would end up losing your tattoo over a period of time. And so you need to make sure it goes all the way down into the actual dermis part of the skin, and then it retains that color. The bottom picture just shows that some people do have an extra nipple. So this is showing an extra nipple. Moving on into wound healing. There's going to be two kinds of wound healing processes that can occur depending on the depth of the injury. Now, if it goes down to where you see it on the first one, the epidermal wound healing occurs following superficial wounds that affect only the epidermis. And that's actually going to be the picture where it goes down. And if you look over to the right, that one's not going to go down quite as deep. It looks like it goes down through the stratum corneum and the stratum granulosum. You see that stratum basale is still going to be fine there. If you look on the right-hand side, you see it actually does go all the way down to the dermis. Deep wound healing occurs when an injury extends into the dermis or even into the subcutaneous layer. So if you look at the picture on the right, you see how it's going through the epidermis, down into the dermis, and actually towards the bottom section where you would find the hypodermis. If you look over to the right-hand side, you see what's referred to as the maturation phase, so it's starting to actually heal. The inflammation phase was on the right, and so that's where it's inflamed, and blood cells are flooding to the area in order to help fix it. Right, and that's going to end us for the integumentary system. Putting it all together, you can look at this diagram, and it'll show you how different systems in the body work together with the integumentary system. And I'll see you next time for our next set of notes.